is recorded, and the recording will be published later online on our Yale Center on Climate Change website. And during the seminar, if you have any questions, please feel free to type in your questions in the chat box. So without further ado, Pablo, welcome.
Thank you, Guy, and thank you for the audience for being here. Thank you for the invitation. For me, it's an honor to be sharing the information that we have from different research projects and share it with people outside of Puerto Rico. Please let me know when you can see my screen as not duplicated. Can you see it well?
Yes.
Okay, please. Perfect. Thank you, Kai. Let me move this out of here, and also let me minimize this. So again, thank you for the invitation. I'm Pablo Méndez-Lázaro. I'm an associate professor at the University of Puerto Rico Medical Science Campus. I've been working at the Environmental Health Department for 13 years. I'm a geographer by background, but then I switched right there interdisciplinary research and graduate school on marine science and hydroclimatology and climate change. So therefore, probably I can have a little bit of flexibility when changing from one topic to another. In this case, I'm going to be talking about atmospheric conditions that are impacting or affecting public health, and what kind of research we're doing in Puerto Rico, mainly with Saharan dust. So basically, we do have two research projects that are funded by NASA, NASA ROSES, which is also the Health and Air Quality Program. The first one is a research project that we submitted back in 2017. We have been working with 3 different working groups, and mainly we propose to use the early warning system to develop early warning system using satellites information, ground-based stations, and also to quantify the impacts mainly on respiratory diseases on Puerto Rico. I'm going to be speaking about a little bit what is Saharan dust. Most of you probably are aware of the Godzilla dust event that occurred in 2020, but for those of you that are not aware, I'm going to be explaining a little bit what is Saharan dust and the seasonalities in Puerto Rico. So to do that, we proposed 3 different working groups. The first one, which was the responsible of working on analyzing the intrinsic relationship into the dust and public health, using different methods and approach, qualitative analysis, but also quantitative analysis using secondary databases. The second working group was the one responsible of analyzing, we call it atmospheric forcing and air quality. And this was the one responsible of analyzing and doing the characterization of the dust using ground-based stations, but also diesel particulate matter. And you will ask, okay, so why diesel particulate matter? Because in our case, we believe that, not in our case, I think that all of us agree, I'm preaching to the choir in this case, but natural sources of air pollution are interacting with anthropogenic sources of air pollution. So one of the main sources of air pollution in Puerto Rico could be considered diesel particulate matter, the anthropogenic sources, right? And one of the main natural sources of air pollution are the dust that are coming from the other side of the Atlantic. So we were wondering as well, what could happen as both of these aerosols and pollutants get together, and how the conditions in the air quality can get deteriorated because of the simultaneous events. And the third working group is the one that we call Decision Support Tool, Computation and Visualization. And this one is the working group that is responsible of developing the early warning system in collaboration with the National Weather Service, the office in San Juan, and the Department of Health. So we call it it's like a co-design. It's a human design centered approach, where we are working directly with end users to see how can we help them to improve decision making for this kind of hazards, and how to protect the population when this threat is arriving to the Caribbean. Mainly, again, we started with Puerto Rico, but this kind of tool could be scalable to the rest of the Caribbean, because what we're using are satellite information, and this information is available for the whole region. So to do that, I first built a multidisciplinary team. This is who we are, a multidisciplinary team of epidemiologists, climatologists, people from remote sensing, chemistry, atmospheric science, and climatology. All of us working together to do this kind of research and developing early warning system for the Caribbean region. And what is this Saharan dust? So in the case of the Caribbean and the Sahara, this is our aerosols and mineral dust that are coming mainly from the Saharan Desert. The Saharan Desert is one of the biggest deserts worldwide, and it can provide over 20 millions of tons that can reach into the Americas. When I'm saying the Americas, not only to the Caribbean region, because it depends on what season of the year. South America can be impacted by this dust coming from Africa, but also North America and the Caribbean region. In the Caribbean, these events are associated with increase on excessive risk of emergency room visits and hospitalizations related to respiratory diseases. This is has been observed in Grenada, Guadalupe, Martinique, and in Puerto Rico as well. Well, we were working with this natural source of air pollution affecting public health. All of a sudden, it appears the coronavirus SARS-CoV-2, so which is the responsible of the COVID-19 pandemic that we're suffering. The first cases of COVID-19 in Puerto Rico were registered in March 2020. So very early after the pandemic, I think that the first cases in Europe were registered in December 2019, and then it took only a couple of months for the virus to get to the Caribbean region. And when that happened, we were able to wonder ourselves, okay, so we have been working with Saharan dust, and this dust is associated with hospitalization and emergency room visits due to respiratory diseases. So what could happen to this patient, or what could happen in the Caribbean if we are facing two hazards that both are different hazards, but both of them are affecting the same system, the same respiratory system. One is air pollution, natural sources of air pollution, and the other one is a virus. But again, both of them are interacting, affecting the same system. So why we're doing this? So, and why we are also including some other environmental factors, okay? So air pollution is being considered like a silent killer. And it's not only the anthropogenic sources of air pollution, but there's many other natural sources of air pollution that can exacerbate our health. Right, and it's been acknowledged by the World Health Organization, but also by the CDC and some others important agencies worldwide. And some other factors that we are considering, for example, I'm just going to be talking about very slightly about the other one that is another climate hazard that could be considered a silent killer, is extreme heat. And according to the CDC, for example, extreme heat, at least in the United States, it can be considered the #1 weather-related death. So it's the #1 responsible for death when we're talking about climate and extreme weather events. So in terms of public health and mortality, when we're talking about air pollution and extreme heat, both of them are ranking first or second. It depends how do you look at it. Both of them are considered #1 in terms of impacting or affecting public health. In the left side, what I'm showing is the weather fatalities that occur in the United States, in the 48 continental states. And as you can see, for example, when we're talking about weather fatalities, they're not associated with hurricanes, are not associated with floods. Most of them, again, are associated with heat and extreme heat, right? So these are two very important components because you will see that right after our result, what we're seeing as preliminary results is that actually both of them are interacting with the pandemic and are exacerbating the conditions and the patients that are struggling with the virus. So as I mentioned, this is something that I think that all of us, if you're coming from the Fellow School of Public Health and from environmental health, most of you are aware. So there are multiple sources of air pollution, and we have two first categories. The first one is the anthropogenic sources of air pollution, which are from transportation, for example, airplanes, ships, trucks, vehicles, whatever. Some others are from the industries, but also we have natural sources of air pollution, and this is where we are doing emphasis in our research. And the natural sources of air pollution, and the source of the pollution, it can be thousands of kilometers away from the places that are getting affected. And in our case, for example, we're talking about natural sources of air pollution that are 5,000 to 7,000 kilometers away from the Caribbean region. But actually, they have the capacity to be transported by the trade winds in some seasons, some specific seasons, and to impact the region mainly in the Caribbean. The Saharan dust or mineral dust are not the only one and not the only natural sources for pollution. We can see also some volcanic ashes. We can see sulfur also from volcanoes. And we have also mold and spores that can be provided by the vegetation in the tropical landscape, for example. But there are multiple other sources of air pollution, again, that are affecting or are interacting with public health. What is the Saharan dust? So these are mineral dust particles that can fly literally and can be transported by the trade winds. They're coming mainly from the Saharan desert, but also the Sahel desert is another source of this kind of dust. But we're using the Saharan dust, right? Because it's the main source of the particles that are getting to the Caribbean. And we're measuring this as aerosols. And aerosol is basically different small particles that could be liquid or solid that are suspended in the atmospheres. As I mentioned, it could be dust, but sea salts as well, volcanic ashes, smoke from fires, biomasses, and factory pollution, right? Again, in our case, we are particularly interested in working with these particles that are coming from the other side of the Atlantic. These particles are very important because they provide nutrients to terrestrial ecosystem, but also to ocean ecosystem. So it's very important. But when we're talking about public health, that's the negative component because in some cases, this particle, they are coarse, right? So in some cases, they are big enough, but to fly from to be suspended for a long period of time and to cross all over the Atlantic, suspended in the atmosphere, some of these particles are very small in size. And that's why it could be dangerous for public health because some of them have the capacity to get inside of your system very deep. And in some cases, because we're talking about particles that are very small, right? This is another way on how to see it. We have the source, which is in the African continent, in the northern side, from Sahara and the Sahel. And we need some specific conditions for this sediment to get left by the air and to be transported by the trade winds to the other side of the Atlantic. So we need to consider the wind speed, wind direction, and also the conditions that are causing the lift to occur in the Saharan desert, right? So when all these planets are aligned, that means that a dust cloud could be transported to the other side of the Atlantic, okay? The main season in the Caribbean of the African dust arriving to our region are mainly during the summer, right? So it's also interacting with the hottest season in the Caribbean, and also is interacting with the tropical storms. So you will see that the seasons start to increase. The Saharan dust, these aerosols arriving to the Caribbean, are increasing after May, receiving a peak of the season during the months of June, and then starting to decrease again during July, August, and September. And September is the peak season for the Caribbean region, for the hurricane Caribbean region in our case. So the Saharan dust is also, and these aerosols are interacting also with the atmosphere, which is important because this is dry air. And in some cases, this Saharan dust also is associated with inhibition of the formation of tropical storms and powerful hurricanes. We still need to analyze better that kind of information, but the scientists are still wondering how these interactions could be positive in some cases for hurricane formation in the Caribbean. These aerosols are also associated with an increase in PM2.5. As I mentioned, some of them are bigger than PM10, for example, but some others could be as small as 2.5 or even smaller. And that's why they have the capacity to float and to be suspended in the atmosphere for thousands of kilometers, right? So when these dust clouds arrive to our region, it's also increasing the concentration of PM2.5 during this season, and it's associated with the peaks events, right? And as you can see, I'm just citing here that the dust is positively associated with cardiovascular and respiratory conditions in the Caribbean, and in this case is related to Puerto Rico, but also is associated with asthma hospitalization and emergency room visits in children, which we are talking about kids in Trinidad and Tobago, in Guadalupe, and Grenada. So one of the channels that we're using to identify these aerosols is the aerosol optical depth. The aerosol optical depth is by scattering, the light scattering that we're receiving using satellite remote sensing and information from different sensors that I'm going to be speaking about. And so this is they have no maximum units. They can go from 0 up to 2 until now, after we saw with Godzilla. So 0 means that there are no visible particles in the atmosphere that could be identified using these sensors. And the higher the numbers, it means that a lot of particles are in the atmosphere, are being identified using the satellites that are floating in the atmosphere, okay? In terms of the data that we're using, as I mentioned, we're using different sources of data. So we're using VIIRS, which is Visible Infrared Imaging Radiometer Suite. And coming out from that sensor, we're using AOD. AOD, again, is Aerosol Optical Depth. Then we have a scatter Armstrong exponent, which is, this is an important variable because it is associated, the lower the value with this, the Armstrong exponent, it means that the particles are more associated to be dust, okay? So it's a proxy, because when you're using satellite information, you're not seeing necessarily the distinction between dust and some other particle that can be floating in the atmosphere, as I mentioned with ashes. But if you look at other kind of signals, for example, and in this case, the Armstrong exponent, you can have a better idea of what kind of aerosol is floating in that dust, okay, in that cloud. So we are using Armstrong exponent, but also mass concentration to understand and to see the better how this atmospheric variables are interacting with other environmental factors nearby the Caribbean region. We're also using sea surface temperature to see how it can influence if it have cooling effects over the ocean or if it has a warming effects over the ocean. And it's tricky. It depends on how is occurring this dust cloud, the day, the concentration and the amount of dust that can be present. We're also using MODIS and UTCI, which is from Sentinel. This is a Universal Thermal Climate Index to see again the interaction with the occurrence of the Saharan dust in the Caribbean and the temperatures in our region. To do that, we started analyzing daily values since 2012 until 2020 to have all of the current databases. There are different satellites coming from NASA, for example. Some of them are geostationary data and some others are orbital data. And when we say geostationary data, for example, to use geostationary data, it means that it is a satellite or a signal that is providing you information very frequently from the same spot of the Earth constantly, right? So like, as it can be with GOES, for example, we're also using GOES to develop the early warning system. But if you want to understand the trajectory of this system, for example, so then we're using, for example, VIIRS, because VIIRS is a polar orbit and it's a satellite that is turning around the Earth and is providing you information about what is happening with these aerosols and the atmospheric conditions in other places of the world, so you can understand what is happening with the source of the dust that are probably coming to your region in the next couple of days. So we're using two different formats of information. One is geostationary data that are coming from GOES mainly, and the other ones that are coming from VIIRS that are orbital information. The orbital information has a limitation because, for example, in our case, Puerto Rico is very small. So it means that the VIIRS is only providing data, very accurate data for the region every couple of days, for example. It's not necessarily, it's like between 5 to 7 days, the interval or the frequency when you can have information for aerosols in the Caribbean. But if you're using GOES, for example, GOES is providing you aerosol information constantly well, most of the time, there are other limitations, but I'm not going to be speaking about that. There are other limitations about this geostationary satellite, but it could be providing you very frequent information about the aerosol optical depth in the region. So with all this aerosol, we have in place the first experimental decision support tool. This is how we're calling it, in collaboration with the Puerto Rico Department of Health and different 19 organizations, health clinics, and the National Weather Service. It's being posted in the webpage of CARICUS. CARICUS is the Caribbean Coastal Ocean Observing System, and it's already a platform that is providing meteorological and climate information for Puerto Rico and the U.S. Virgin Islands. So in this case, we're making leverage of that existing platform to provide to the audience the information that we're obtaining in this area. So we're retrieving data from 4 different regions in Puerto Rico, and these are the 4 tachometers that we have. We identified the level of risk based on the information that we obtain with the health clinics, with patients, and with the secondary data that we analyze. And based on that impact, we have the first warning system for level, mild, extreme to very extreme conditions in terms of air quality. And it depends on the color. And we have 4 different sites distributed in the most populated region of the island to provide that information in real time. And also we are developing the early warning system, meaning that it will be a forecast to give this information to the general public in advance for them to take precautious actions before this dust is arriving to the Caribbean. So this is our just example of how it looks like. The images are very raw, obviously, but as soon as you get into the web page, you can use it in your app, and you can see the tachometers providing you in real-time information about air quality associated with aerosols. This information has been used also to develop educational materials and to do outreach with the National Weather Service in Puerto Rico, both in Spanish and English. It being used by the Department of Health. So now as we have like a prototype, as you can see here in October 3rd, 2021, we suffered one of the most recent dust cloud after the Godzilla dust event that occurred in 2020. And most of the agencies that were working with us and collaborating, they were using this information to make the population aware of the unhealthy conditions that we were facing, for sensitive group to take precautious measures. This is another example. Then on October 7th, the agency were using our information to provide the best information as possible to the general audience and to sensitive groups. We did a couple of webinars impacting over 400,000 people in Puerto Rico. We did it with NASA, with the National Weather Service. We did it with Ecoexploratorio, which is it's a science museum in Puerto Rico that are being responsible of providing a lot of education and webinars. So they did most of the outreach, and we did all of the science to the audience. So we have already now also an air quality awareness week in Puerto Rico, and it's happening all year, and at the beginning of May. So during the month of May, we are giving webinars for the general audience in Spanish and English, 2 different sessions for to comply with Puerto Rico, because in Puerto Rico 98% of the population are Hispanic and Latino, and is the main is the principal language as spoken here in Puerto Rico. Okay, so with that being said, something happened in between while we were developing the early warning system and when the first cases of COVID-19 arrived to the Caribbean. So as I mentioned at the beginning, so the Saharan dust is associated with an excess risk of emergency room visits, hospitalization, and in some cases, partially attributable to death. Okay, partially attributable. That doesn't mean that you are dying because of the Saharan dust, but with some other comorbidities and some other interactions, you might be suffering for exacerbations, and you are most likely to die. So what we did is that all of a sudden, the first cases of COVID-19 get into Puerto Rico in March 13, 2020. And then NASA opened another call for proposal requesting to work with the COVID-19. It was a rapid assessment. So we wasn't expected an extreme event of dust as it happened during the summer of 2020. But since we were already working with the Saharan dust previously for 5 years or more, we had this project, but we have been working with the Saharan dust for more years. So we were wondering what could happen if we have an extreme dust cloud event getting to the Caribbean, deteriorating the air quality, and also having a lot of cases with COVID-19, right? So if already the Saharan dust is associated with an increase in the demand of healthcare facilities, what could happen if we were seeing the news in other places of the world where the hospitals were collapsing because they didn't have the capacity to provide the services to the patients, right? So we were wondering when we were submitting this proposal, what could happen if both of them are simultaneously occurring in the same time, right? We submit the proposal, we obtain the grant, and we quickly get working with the research. As I mentioned, when we submit the proposal, it was in April 2020, just a couple of weeks after the first cases of COVID-19 reported in Puerto Rico. By that time, we were not expecting to have Godzilla dust event. And for those of you that are not aware of what was Godzilla, Godzilla was a dust cloud that arrived to the Caribbean region. And we stayed under unhealthy conditions due to air quality for more than 3 days in the Caribbean region. So it was a little bit overwhelming. So what we did is that we designed a couple of instruments to work with physicians, with patients, and to better understand vulnerabilities. We designed a couple of qualitative instruments because we believe that working in public health, that the qualitative instrument could be richer in some cases because they can provide you information about the barriers, vulnerability, risk perception, about how the people are working with this risk. This is risk perception as well, right? So we recruited more than, sorry for those noises. We recruited more than 55 physicians and over 100 patients to work with them. We also made a couple of memorandums of understanding and agreement with different clinics in order to receive medical records information, because not only understanding the number of cases that are getting into the hospital, but how these patients' conditions could be exacerbated with the Saharan dust. And also we started to analyze the all-cause excess mortality, island-wide, not only in some places, in interacting with the environmental factors. So this is like only a graphic showing when the first cases of COVID-19 arrived to Puerto Rico and to the Caribbean, and then how we suffered Godzilla dust event. The bigger the number in the right axis, as you can see, are aerosol optical depth. It means that the most extreme values we observe for aerosols and these particles arriving to the Caribbean. It was a dust huge enough, a cloud huge enough that it almost covered all the Caribbean Sea together, all of the Lesser Antilles, and also from Puerto Rico to Trinidad and Tobago. It was big enough, but also with a lot of concentration. Higher values were observed during that time. In the central part of the graphic, what we're seeing here is that the black line are representing the years of 2020, the different months. And as you can see, it marked a record for aerosol optical depth in our region. And again, Puerto Rico stayed for over 3 days with unhealthy conditions due to this Saharan dust PM 2.5. And the bars, what we're seeing here, are the number of cases that we had been registered of COVID-19 and hospitalizations in some places of Puerto Rico, right? This is only a graphic. I'm not making any kind of assumption with the graphic. This is just to show you the patterns that were observed during that summer. The lines are aerosol optical depth. The bars are hospital admissions. So in all places of Puerto Rico, as I mentioned, in all our 4 tachometers, you can see the Godzilla dust event marking a record as never occurred in the last decades or even prior to the decade. Satellite information, the one that we're using, is only going back until 2012, but using ground-based station, you can go as back as probably 20 to 30 years before from now. And it was also a record for this dust event in the Caribbean. These are only pictures for you that can see how the visibility decreases so much in some places of Puerto Rico. In the right side, we are seeing the southwest of Puerto Rico. This is Guanica Bay. And on top of it, you can see the day before the arrival of the Godzilla dust event, and then very early at 9 a.m. in the morning. So the visibility decreased up to 3 miles only in most of the island, when the visibility in Puerto Rico is mostly 20 to 21 miles. So you can imagine the deterioration in air quality that it happened. So working with the physicians, most of them were agree that there were the severity of the symptom of the patient of COVID-19 could be most likely to be exacerbated because of the dust clouds. And when we were working with the patients, some of them were telling that they were more sensitive to these aerosols after being confirmed with COVID-19. So they were more sensitive after surviving the COVID-19 than they used to be before having COVID-19. So in somehow it means that nowadays they're most sensitive. We also did another survey where we were lucky because we had 1,500 participants that worked with us, provided a lot of information. Most of them were female, so we need to highlight that. So that's important to say, between 25 to 44 years old. But something very important is that almost 65% of the population had historically one chronic conditions. And those individuals with at least one comorbidity are 14.37 more likely to need medical services when they are facing the Saharan dust in Puerto Rico. And this is what happened, for example, with the Godzilla dust event. Most of the people that participate, 90% of them are indicating that Saharan dust is affecting both their family members, but also their own health status. So not only the participants, but also they consider that in their family members are also getting affected by this atmospheric conditions. Asthma is important because most of the respondents and the participants that participate, I'm saying that 65% had at least one chronic condition, but asthma was the most reported condition. Another important issue is that apparently these symptoms are mild to level, to not that heavy or not that complicated, because only 12% of the 1,500 that participate that were saying that the Saharan dust is affecting the health of their family members and their own health, only 12% are seeking medical attention. So meaning that the impact on health of the Saharan dust, it not necessarily need to be something that, at least with these cases, right, that is going to be saturating all of the hospital and clinics, but only 12% are going to be visiting or are getting, their symptoms are so complicated they need medical attention. To continue working with the public health data, we are requesting the medical records in 6 different health clinics. So nowadays we have 1,200 medical records. The clinics provide this information in paper. So we are now doing the data entry. That's why we are requesting a no-cost extension to analyze this part of the project. And we requested all of the information from the first month once the COVID-19 get to Puerto Rico, after 1 year after, completely, right? Because it was when we were planning to end the analysis. We were not that lucky. It took us a lot of time because we were dealing with legal offices and a lot of paperwork and memorandums of understanding, but finally we have this information available. This is the only missing information that we still need to analyze to better understand how the patients that were admitted or visiting the hospitals, how their conditions were exacerbated by these symptoms. In terms of the databases, and I'm going to be very quickly on this, most of them are the ones that I already mentioned at the beginning. What we were using, mortality, hospital admission, emergency room visits, environmental factors, social heat index, universal thermal climate index, and aerosols, okay? In terms of the hospital admission, this is another graphic, and again, I'm not making another not assumption about this graphic, but what I would like to show is that, as we can see at the very first beginning, we did suffer a couple of cases of COVID-19 and hospitalization in the 6 clinics that are participating with us, and then because of the lockdown and the curfews and all of the restrictions that the government did during that period, we were able to control all of the local transmissions and the infections, and we can see how it went very low. But then all of a sudden, together with the Godzilla dust event, we can see how COVID-19 cases started to increase. I'm not saying again that this is because of the Godzilla dust event, but it's happening very, it's timely associated, if you want, because both of them occurred during the same time and same period, okay? So once the cases started to increase during the summer, then during the fall, during the hurricane season, it started to decrease. There was couple of curfews and lockdown and government restrictions. And then during the winter, which it was expected, the COVID-19 cases started to increase again, and then restrictions, and we can see it here. And again, I'm not saying that the environmental factors are the only one that are associated with COVID-19 transmission and infections. We need to consider so many other social behaviorals and patterns that has been confirmed by the scientists that are also related with the spread of the COVID-19. I show already this graphic, but it's just to highlight again that right after the cases, when the cases started to rise during the summer, we were also facing the Godzilla dust event during the same period. Again, I'm not saying that it was because of the COVID or because of the Saharan dust that the COVID-19 cases get so high, okay? In case of what we have of the hospital admissions, this is our very demographic profiles. And in terms of the mortality is what I think what is very important. So we do have a couple of 9 or more different environmental variables. We only are analyzing, in this case, 9 of them, the one that we think that could be impacting health in Puerto Rico. And we built 18 different environmental indices, most of them retrieved from the satellites data. Since some of them and most of them are correlated because these are atmospheric conditions that have a lot of collinearity. So we only kept a couple of them to have a better understanding on how these variables are associated with mortality in Puerto Rico. So we started analyzing, we requested daily mortality from the Department of Health in Puerto Rico. And as you can see here, this is mortality, total mortality, all causes, non-accidental mortality. Let me clarify that. This is non-accidental mortality. And we create this table for you to see it, for example. So since 2015 to 2020, in Puerto Rico, mortalities used to be higher during the autumn and during the winter. Still don't know why, but this is the patterns that we observe. As you can see, for the last 5 years per season, the higher mortality occurred in the aftermath of Hurricane Maria, not necessarily during Hurricane Maria. Again, not too many people died during landfall, but many people died in the aftermath of Hurricane Maria weeks and 2 weeks ago. So after that, you can see another record that occurred in 2020. But surprisingly, it didn't occur in fall or winter, it occurred in summer. So it means that it's associated also with the COVID-19 cases, not attributable 100% to the situation of COVID, or to the cases of COVID-19, but because of the pandemic, a lot of people were afraid to search for medical attention and a lot of other things that need to be considered, making another record for mortality in Puerto Rico during the summer, which is weird because over the last 5 years, this is the only summer that it marked a record on mortality. This is the first time that we're seeing this. And we're wondering also how much this dust cloud event could be exacerbating the conditions, okay? So when we started analyzing mortality, we first starting by saying, okay, so we have a seasonality for the Saharan dust arrival to the Caribbean. So we have Saharan days, for example, and we have non-Saharan days. And those non-Saharan days are those that are where we are not seeing aerosol optical death. For example, the threshold that we use is 0.18. I'm not going to go into the details, but and the other ones are the days where we can observe 0.18 or values above that for the aerosol optical death. And we started to see that, for example, even though these aerosols are more associated to the summer, but we can see a distinction also on mortality due to respiratory conditions without flu cases, because flu in Puerto Rico has a very marked seasonality as well, and it's more associated with winter. So we took flu cases apart, and we take it out of the database, and we only analyze all of the other respiratory conditions. And we started seeing some specific results. Analyzing it with COVID-19, we observed that actually during the summer, the patients that had COVID-19 were more likely to die when UTCI is Universal Thermal Climate Index. This is another indicator to provide information about how is the sensitivity to heat. Okay, so your thermal comfort in regard of temperatures. Okay, so that is considering wind speed, wind direction, humidity, relative humidity, and air surface temperature, obviously. But it's an indicator, it's an index. It's not an information that is being provided by the National Weather Service, for example, because what they're providing you is heat index or air surface temperature. But we are actually seeing and it's like slightly increasing, or not slightly, it's this time higher, right? The mortality, and this is something that we observed during the summer, which makes a lot of sense, right? We also observed that COVID-19 patients are most likely to die when we do have also allergens that are associated with molds and spores in Puerto Rico. So that's another natural sources of air pollution, as I mentioned. And also when we are starting adjusting all these analysis per age and per season, we are observing that actually the numbers are continuing to rise and are even higher for COVID-19 mortality as it could be expected. And again, in this case, we are not considering the vaccine because we closed prior to the vaccination period in Puerto Rico. So we closed it until March 2021. Vaccine is another story, and vaccination is changing. Obviously, it might change all of these results because and the technology and from the medical component, because there are new treatments, there are innovations in medicines, and a lot of other things that are helping for the patient not to die because of the COVID-19. In terms of other respiratory diseases, we also observed that aerosol optical death is also associated with the mortality of ischemic heart disease for Puerto Ricans, and also it is consistent even when you are adjusting this per year, per season, per age, and the different adjusting that can be done using the Poisson model assumption observations and the regression analysis that we did. For further considerations, I think that we are hungry to analyze the medical records because we are still doing the data entry. We still have only numbers, as I show you, in terms of increases in hospital admissions and emergency room visits. So we were not able to analyze and to have a better results with mortality. But mortality is only the tip of the iceberg, meaning that if you are able to identify that mortality is increasing because of some specific conditions, you might expect that also, you might expect to see a lot of people searching for medical attention, but are not that fragile to die, for example, and some others that are getting affected, but not even considering to search for medical attention, right? So these are important findings, because for Puerto Rico, I think that we are not only developing the early warning system for a hazard that is deteriorating public health in the region, but also this is one of the first times that we can provide evidence that the Saharan dust is in somehow related with mortality as well. Again, partially attributable. Something is a statistical analysis, and some other is that by doing the qualitative analysis, talking with the physician and with the experts, with the informants, we might be able to explain better how this hazard is deteriorating the health of their patients. We still have a lot of other questions to be that need to be answered in order to identify the vulnerable patients and population. I think that it's important that we are developing early warning system. You need to identify your target population, because this is when is how exactly if you're talking about the population that are getting flooded or not. So you need to address your communication, your risk, your advisories to the more sensitive groups, in order for them to take precautions before the arrival of this dust cloud. So we will continue working on this, and we'll stop sharing my screen, and I'll be happy to answer whatever question you may have.
Thank you so much for the wonderful presentation, Pablo. And just a reminder to the audience that if you have any questions, please do put them in the chat box. And well, for this seminar, we have 19 students attending, and we actually have already collected some of the questions from the students. So while the audience are putting their questions in the chat box, maybe I can start with two questions from students. Actually, there are two types of questions the students are mostly interested in. The first one is actually probably shows how to disentangle the interactions between the dust and COVID and the all the environmental factors. So many students actually are wondering how to control for confounding factors, like from human behavior, like people may spend more time indoors during the Sahara dust.
That's a pretty good question. With the data that we have from mortality and medical records, it's a little bit complicated to have that kind of information. The only way that I will say that it will be useful to receive more accurate information in that regard will be by doing interviews, one-on-one interviews with the patients, for example, identifying or doing focus group directly with all of them. That's another way on how can you measure exposure, right? Well, not measure, but at least having a proxy on the exposure for Saharan dust. So yes, it was complicated because during this Godzilla dust event, we were struggling with COVID-19. One of the recommendations, at least in Puerto Rico, and I think that is also in the United States as well, happened, is that the agency were suggesting the population to open the windows and doors to let the clean air to get in. So they would receive a lot of memes from people that were saying, okay, so if I open the doors and the windows, then my house will be full of sand. So what do? I cannot open the windows. I cannot open the doors because I have an outdoor hazard. But if I keep it closed, then if someone bring the virus inside of my house, I might probably get infected with the virus. So yes, it was a little bit not funny, but a lot of people took it that way. And you can see a lot of memes that came out during that season. Mm-hmm.
Thanks, Pablo. Yeah, it's very complicated, and when it gets to real policy recommendations, I think that's very a lot more research needed. I do see another question from Rob Dubrow. Professor Rob Dubrow is the faculty director of our center. So he asked, is there evidence that climate change is affecting Sahara dust in the Caribbean? For example, is there anything known about what caused the Godzilla dust event? And I also want to mention that this question, it combines with one of the students' question that are wondering not just dust, but also other like hurricanes in Puerto Rico. Does climate change, introduce some additional these extreme weather events, and can they play a role in the COVID prediction in Puerto Rico? So two separate questions, but kind of related. Thank you.
Let me see how can I address this. And thank you for both questions. Let me mention something very quickly related to the other one, to the first one. By using masks, one of the recommendations from the CDC, we are unable to minimize the exposure to this dust, right? To these aerosols. So that's something very important that we need also to highlight, because most of the people in Puerto Rico are using masks outdoors, even outdoors, right? So that's important. Okay, so in terms of climate change, yes, there is evidence that is in some cases that the Saharan desert is getting bigger. So that could mean, let me say it like that most likely the source of mineral dust could be increasing in terms of tons of sediments that could be lifted by the air. But we need some other kind of conditions to make this dust to arrive to the Caribbean. And for example, wind directions and wind patterns, right? So if you don't have the wind velocity or the capacity to lift these particles to be transported floating in the atmosphere to the other side, is another story. But yes, the source is increasing in the Saharan desert. So it means that it's getting drier some places in Africa and also to the southern part of Europe. So most likely, again, providing more sources of mineral dust to the atmosphere. If the trade winds continue to be the same, we could say that probably it will increase the amount of dust that we are receiving. But until now, there is no evidence suggesting that we are receiving more dust than ever. We do receive a record that it was marked by the Godzilla dust event, but it's not marking a trend. Okay. In terms of other sources of extreme event, for example, yes, Hurricane Maria devastated millions and millions of trees and vegetation and green infrastructure, right? So right after Hurricane Maria, with a lot of humidity, we mark another record for mold in Puerto Rico. And mold is another natural source of pollution, allergens, right? And that was amazing. So Hurricane Maria switched a little bit the patterns and the behaviors of these allergens that are associated with the vegetation. And so meaning that these powerful extreme events have the capacity also to change how these allergens are being distributed along the year.
Thanks, Pablo. Yeah, I just want to mention one of the things that in terms of the dust, there's also some research from the European side saying the Sahara dust, although larger in size than the PM2.5, they do bring a lot of health effects to the respiratory systems. So I think in addition to the COVID work, your Sahara dust work is also very interesting. I do encourage our audience, if you do have questions, please feel free to put it in the chat box. And if not, then in the meantime, I want to ask a final question from the students. Actually, the students are very excited about the public health early warning system that you're creating, and they're wondering, you study a lot about the interactions of all these seasonal pattern, the environmental factors, and they are wondering, like, when you actually put them into the policy recommendations, what are the experience or source you have, and how effective that could be?
Well, I have two great experience in Puerto Rico, mainly with the Puerto Rico Department of Health, because you have two different agencies that are responsible of working with this, right? The National Weather Service is the agency responsible of monitoring the weather and the atmospheric conditions, but they are not responsible of issuing any kind of warning to protect public health. This is the responsibility of the Department of Health. So you need that coordination, one agency to monitor the weather and to provide that warning for the population, and the other one to tell the population what to do, because this is a public health issue, right? So I started working with them since the very first beginning. Both of them were very committed, wanted to work with us very closely. And so that's how we gained that trust. So now all of us together, we're working on that. So the recommendations are coming out from meeting groups that we're having from all of our team, epidemiologists, physicians, and climate atmospheric scientists, working with the National Weather Service and the Department of Health. And all of them are listed. So once the warnings are posted by the Department of Health, then you will see the list of actions that you will need to do or to follow in the case if you are as part of the sensitive group.
Thanks, Pablo. That's excellent point. I think we anchor your point that, you know, to deal with the COVID pandemic, also climate change, we need multi-departmental and collaborations from researchers across and also from different governmental agencies. There's a follow-up question from Rob. How far in advance can you predict the levels of Sahara dust in the early warning systems?
Well, now I suppose that we might have up to 72 hours from now, and it will be available somewhere between this week and the other one. But for now, if you go into the webpage, what you will see is only the real-time information. We're still working on the early component to provide the information in advance. So we have this year to continue working completely on the forecasting. Yeah, for 72 hours. We will have it very soon, this week or the next week, and we will have one full year to work it with the decision makers and with the community on how to improve it. To test it. Mm-hmm.
Yeah. Thank you, Pablo, for the wonderful presentation and very engaged discussion. And thank you all for joining us today. I think let's give the final applause to Pablo for the wonderful talk today. And thank you everyone for coming.
Thank you for inviting me. Happy to be here.
Bye, everyone.
Thanks, Pablo.
Ciao, Robert. Good to see you.